Hi, Dr. Kotar. My name is Samaria.
Hello.
Hello, and welcome to our panel discussion, Myths versus Facts about the COVID-19 vaccine. I'm your moderator, Dr. Carrie Jones. I'm a biology and anatomy and physiology instructor, professor here at KCC. My co-hosts are KCC student Samaria Rosenthal, the student representative to the KCC Board of Trustees, and Tristan Hahn, president of KCC STEM Club. Our other panelists this afternoon include my fellow biology faculty members, Dr. Jonathan Cohen and Mr. Ken Mager. Finally, our keynote speaker today is Dr. Amaal Tokars, the Assistant Director at the Illinois Department of Public Health. Dr. Tokars has a Master of Science and Doctorate in Education from Northern Illinois University. Her master's focused on the area of systems therapies in the clinical setting, while her doctoral work emphasized her love of organizational learning, social movement, and research methods, and included a minor in anthropology. She's also a graduate of the Navy Postgraduate School Executive Leaders Program in California. Her work experience includes over 30 years in behavioral health and approximately 15 years in public health, clinical policy, and research. Some areas she is particularly passionate about include cultural equity, health ethics, systems change, international policy, and engaging in dialogue about the essentialities of a thriving civil society. Today, Dr. Tokars will be speaking to us about the science behind vaccines, as well as some of the myths currently surrounding the COVID-19 vaccine. Please welcome Dr. Amaal Tokars.
Thank you so much. Thank you. Shall I go ahead and get started then?
Yes, please.
Okay, well, first of all, I can't see all your faces, but I'm so pleased to be with you. If you are here, then you must have an interest in learning a little bit more about COVID-19 and some of the understandings that are out there and expanding your own understanding. So I'm going to start out by saying something about what's happening in the world now and setting the stage for where we are many months now into a pandemic that has surprised us all. So first of all, it's important to know that on the globe, if we're to look at the burden of disease as it relates to COVID-19, the United States is one of the nations that shows high transmission compared to other nations on the globe. We are not the highest transmission at this time. Countries that have higher transmission at this time are appearing right now in Europe. And there are many possible explanations for this, many explanations, but these are also, some of them are denser countries than we are. Also, the European Union has allowed travel very, very fluidly between these countries, and so that makes it a challenge as well. But the United States has, throughout the pandemic, once we showed high transmission, really struggled to bring that transmission down relative to brother and sister countries in the world. So I think it's really important to know that, what a challenge that is. Also, when we look at the states in the Union of the United States, most states in the Union are showing high transmission at this time. There are only about 10 states that are showing substantial transmission, which really means also significant transmission, but high really is quite high. Illinois is one of those states. There is only one sector of the United States at this time that is showing moderate transmission, and that is Puerto Rico. But all the other states of the Union are either substantial or high, most of us high, and that includes Illinois. So I want to let you know that as a setting, because sometimes we are just thinking about our circumstances. We are going to work, we're going to school, and it's hard to pay attention to all these things, but I think it's important for you to have that for setting the stage. I want to start out by, I'm going to have to take a sip of water, excuse me. By answering one of the questions that has been put forth. And this question, I want to start out with one of the ones that seemingly is more provocative. I'm so sorry if I have to start sipping on water more, but this question is about hydroxychloroquine and ivermectin. Excuse me, sorry. And whether or not we should be for or against these medications in use for COVID-19. So here's what I want to say to you. Neither of these medications at this time are fully accepted or approved for human COVID-19 treatment. However, that does not mean that they will not have a future use for COVID-19 treatment. Both of these are continuing to be studied. And I think the more important thing that I want to say to you is you are in school to develop yourselves. And if I were to ask you how you want to develop yourself, some might say, I want to make a good living. Some might say, I want to study something and get into a career that is rewarding to me. But hopefully many of you would also want to develop yourselves in terms of your human discernment and how you think about things. So be careful about these dichotomous discourses where something is all good or all bad. In fact, it's very important for us to learn more about both of these kinds of medications. When things are approved, they're approved in a rather precise format for your safety to be used in certain dosages under certain circumstances. And we also want to see those clinical trials have congruence with the way that they're actually going to be used. So there isn't any reason to be absolutely for or absolutely against. So I want to set the stage with that, because so much of the discourse that we have in this country at this time can end up being very dichotomous. And be aware of those dichotomous discourses so that you can have the ability to discern more deeply about these things, because there's so much more to learn and so much more to come. So I spent a little bit of time answering that question, partly because I was choking, but also because that's a very important question. Another question that you had that was very important is about how about the risk of death and adverse effects around the vaccine? So these vaccines are designed to incite a meaningful immune response, So it is intended that it would be normal that individuals will have symptoms when they get the vaccine, or responses. I shouldn't use the word symptom, responses like a headache, tiredness, could have even a low-grade fever, and a number of other things. This does not mean that an individual is contracting the virus. In fact, they are not contracting the virus, nor can they transmit the virus from these normal responses. But the real adverse responses are ones that have been proven to be very rare. And these have to do with this thrombosis or an allergic reaction. And individuals would know that they were having these because these will show up within hours or the first few days after receiving the vaccine. The more these vaccines are administered, the more rare, based on the larger spectrum, that these responses are. But the normal responses that I've mentioned to you, these are not adverse responses. These are normal responses that individuals should have. What we do know, and this is very, very important to note, is that most of the people that have died of COVID-19 have not been vaccinated. Almost all of the people that have died have not been vaccinated. Most of the people, now that the vaccine has been being administered, that are hospitalized for very serious reasons, are not vaccinated individuals. And most of the individuals that need to be put on artificial respiration, meaning these helping them with these ventilators, are also not vaccinated individuals. So it's very, very important to know about those trends. And the longer that we go on, the stronger those trends appear. So I want to mention that to you. Another important question that has been out there is, are these vaccines considered experimental? And the answer to that is no. These vaccines are not experimental, even though we are still understanding more and still studying things. It does not mean that they are experimental. So the time where these vaccines were vetted, they went through the full process, and you can see I'm trying to answer more than one question that has come up here. They went through the full vetting process because these are vaccines that were developed during the pandemic. These were able to be developed more readily, but shortcuts were not taken. So what do I mean by that? So there are many times where vaccinations are being developed where there aren't many people sick around us with the very thing that the vaccine is being developed for. Well, these vaccines were being developed where at a time where there were increasing numbers of individuals that were sick. And so it was very, the scientists that were studying them were very able to see the impact of the vaccines very early on, because people were so highly exposed to the virus. So there were no shortcuts taken, but we did have the unique times of being in pandemic, and that did make these processes go very well for the vetting of these vaccines. What else do I want to say about this? Another really important question they had is, what is the evidence for safety for persons that are pregnant at this time and taking the vaccine? So that is not an easy question, because at the time of the clinical trials, they were not specifically for persons that were expecting. They were for any adults, including for individuals that were expecting, but they were not specifically for that. So the way that we are understanding that now is that there are many persons that have been expecting and have taken these vaccines safely. Still, any individuals that are concerned about these vaccines should go ahead and consult their primary care physician. And that is a personal decision that individuals will make alongside of their primary care physician, but the primary care physician will want that individual to make their own decision on that. Now, there's something else that I want to say to you that is not yet being talked about a lot in the literature as it relates to COVID-19, but I want to plant these seeds for you. Long before the pandemic, many of us talked about family life planning. And some of you may or may not know what that is. But that means for any adult that is discerning, that is thinking about when they want to have children, do they want to finish their education first? Do they want to be at a certain place in financial security? How do they want to space out those children? And what are their aspirations for their children and their own lives? This is called family life planning. At the time of H1N1, several years ago, there were people that found themselves expecting during the time that the vaccine was available. They were not able to plan in advance. They could consult their physician about it. They could get that vaccine, and many people did, but they couldn't apply family life planning because there was no notice. In this case, there have been many months of notice prior to this vaccine being available to us. And the vaccine became available to most of us in mid or late spring. For some people, depending on their profession, it was available earlier, but we have had a long time of notice and the ability to plan. So we are able to plan for spacing out our children, knowing when we want to get that vaccine, when we want to have our children, if we want to do that in between, if we happen to not want to do that at the time that we're expecting. So there are many, many possibilities, positive possibilities for individuals that plan to have children and want to have children to be able to do this safely. So some people are doing it while they're expecting. Some people are choosing to do it before, choosing to do it after. Either way, please do consult with your primary care physician and make sure that if you are working the vaccination in around your pregnancy, that you are still being very, very safe and very careful, because the impact of contracting COVID-19 while being expecting are very serious for the mother and the child, can be very serious. So it's not something to be taken lightly. Do plan carefully. Do talk with your primary care physician and ask all that you want about this, even if you need to do that more than once. So I want to watch the time because there are many more questions that I want to get at here. Another area is we talked about the risk for hospitalization for those people that are vaccinated versus unvaccinated. So it is much higher for persons that are unvaccinated. There are individuals that have had breakthrough infection. Breakthrough means you're vaccinated and you can still get the infection. Know that vaccination provides enormous protection for us, but not perfect protection. Okay, we still have to be careful. We still have to be careful, and that's why we're still wearing face coverings in indoor settings when we're next to other people. I see some of your colleagues doing this. This is very wise if you're next to other people in a room, that not being in crowded positions with one another. These are things, these are basic things that the whole world has learned, not to crowd each other. If we're in situations where we are in indoor spaces and we cannot be away from each other in public spaces, that we can wear face coverings. And again, the vaccine is enormous protection, but not absolute protection, not absolute. So we can have breakthrough infections. And who are we seeing the breakthrough infections most commonly? Individuals that were not protecting themselves in other ways, individuals that are immunocompromised, and many of our elders who are also going to have weakened immunity, but not just elders. So all of us have to be really careful with that. Why do some vaccines last a lifetime and others do not? So it's a very large question. Some of your childhood vaccines are expected to last a lifetime. If I asked you what those were, you might be able to answer that. For example, your measles vaccine, some of you receive this as what's called an MMR, measles, mumps, and rubella. Some of these vaccines use a live these are live vaccines, and these vaccines give very potent protection. Now, that's not something I want to make a flat generalization about, but this vaccine in COVID-19 is not a live vaccine. And so the protection is very potent, but it is not considered necessarily to be a lifetime. We actually don't know what the answer is to how long this vaccine is going to last and whether or not we will need annual boosters. So there's more to learn, but we do know that vaccines like the flu vaccine are vaccine that we need to get annually. And that vaccine is an updated vaccine every year. It's a little bit different every year. It's updated for the anticipated viruses that are moving about. And then there's some vaccines that are intended to be a lifetime vaccine. Now, also there was a lot of question about messenger RNA or mRNA. So the one thing that I want to say about that, we have some biochem people on your panel that are going to be able to probably say more things about that. But one thing that I want to say that's really important, I've already talked about this, is this vaccine is designed, and this is probably the most important thing that I could say, although it's not a live vaccine, it is designed to evoke a meaningful immune response in each of us. And that makes it a high efficacy vaccine. So these are high efficacy vaccines, but high efficacy does not mean that we can just throw in the towel on being careful and that we will never get COVID-19. And these, so this is very important. Now, a couple of remarks that I want to make before we open up to questions. Our elders have suffered a great deal in this pandemic. So if we think about who has gotten sick the most in this pandemic, it has been our elders. Who has been on ventilators most? It has been our elders. Who has died the most? It has been our elders. Who has showed the most resistance against this pandemic and gotten the vaccine and have been the most careful and the most strategic in wearing face coverings and in making sure they're not in crowded places? Our elders. Our elders have set enormous example for us. And it's so important that we not ignore it. It's so important that we not ignore it. And our ability to protect ourselves and pay it forward for those who are among us that are immunocompromised, for the loved ones in our family, our elders and many others, and the little ones that cannot be yet vaccinated. It's really important that we see the example of elders and know that getting vaccinated is not just about us. It is about living in a connected, collective society. We are all connected. That is how the pandemic happened. We are connected to each other, to our brothers and sisters, to our friends, everybody in our school, our community, and to people on the globe and other countries that we will never meet. We are connected to them now, and we are connected to people in the future. And so this is a way that we can pay it forward. If you were to look at a world map of COVID-19, you will see how connected we are and the contiguous nature of this spread. and the contiguous nature of our own wisdom. So we should be able to go forward and live our lives in joy and wisdom and discernment. So without further ado, I do want to give some time before I leave you for some other astute questions that I know that you have.
All right. The first question that I would like to ask is, can you explain the difference between the Pfizer and Moderna vaccines compared to the Johnson & Johnson vaccine?
So there are many things that could be said, but the basics to say briefly is that the Pfizer and Moderna vaccine are two-part vaccines. These vaccines, you are getting your protection and you must have both parts for it. And these are given in approximately 3 weeks from the initial vaccine. Also for Moderna and Pfizer right now, for people who are immunocompromised, they can get a third dose to each of those vaccines, but also individuals who had received those vaccines, their final dose of those vaccines 6 months ago, if they're in an occupation that gives them more risk or have health conditions that give them more risk, they could also receive boosters to those vaccines. Now, the Johnson & Johnson was a vaccine and is a vaccine that many people get very excited about because it is only the one dose. So if people are afraid of needles or not comfortable, and of course, not too many people like a needle, there are many people that received this vaccine. This vaccine is a one dose, and people can get their boosters from this vaccine. We'll be able to get those boosters. And this is a shorter period of time. It's more like a 3-month period of time for people to get their boosters after that vaccine. And there's much more that can be said about the 3 of them, but that's a concise answer for you.
Thank you. Thank you very much, Dr. Tokars. I'm going to jump in with a question that is being asked right now in our question and answer. It says, is it true the vaccine still allows me to contract and share the virus with our elders and children?
The vaccine does not directly, in other words, you cannot contract the virus from the vaccine, even if you are experiencing some normal side effects. But as I've stated, so I'm a vaccinated person. I'll just speak about myself. I still have to be careful about being in crowded spaces, knowing that there are unvaccinated people around me. I still have to be careful because I could contract the sickness despite being vaccinated. I'm much less likely to, but I could. But the vaccine itself, no, you cannot contract the illness from the vaccine. So I hope I've answered that question.
Thank you. Tristan, I think you have the next question as well.
Why should people who have had COVID get vaccinated? Why aren't the antibodies enough for just the vaccine?
Okay, this is a very good question. So there is agreement and emerging ideas in the literature about the natural immunity and how short-lived that is. So where there is agreement right now is that the natural immunity lasts for about 90 days. So there are a number of individuals that will wait, they don't have to, but will wait about 90 days after recovering from COVID to get that vaccine to stretch out their immunity. That is not required, but that is what others are doing. In general, for diseases that are dangerous to you, you don't want to contract the sickness so that you can gain immunity, especially when that immunity is very temporary. So a longer-term immunity, a longer-term protection can be provided from the vaccine, and your getting the vaccine is a much safer experience than getting the illness. So that would be my answer to that. But it's such a good question. Thank you for asking.
I'm trying to look at the Q&A. Could you please clarify? Oh, I'm sorry. That I just want to clarify to the people listening that Dr. Tokars was not saying that vaccinated people cannot share the virus. I think that's what I'm told to clarify. I do have another question from the Q&A, and that's about getting the booster shots. Maybe you addressed this, but the mixing and matching, is that a problem? Are there any clinical trials that have looked at that?
I don't know the answer to clinical trials that have looked at that. That's a very good question. The reason that some people are switching a little bit is because there is some efficacy reporting on how Moderna is doing now versus Pfizer. So there are some people that are wanting to do some mixing and matching. I would suggest that people talk with a pharmacist or primary care physician about that, because it's actually can be a little bit confusing, but there is some of that allowed. Most people are going to go ahead and get the booster from the vaccine that they originally got, but there are some other options available. I think that I have room for one more question, so I want to allow for that.
All right, the last question then, comparing natural immunity to the efficacy of the J&J vaccine, do you think that is the same, or is one better than the other?
Okay, so this is similar to another question. So what I want to say in general is all of us need to know that we do build immunity to many kinds of things by going about our day, but we don't want to depend on that immunity or unwittingly expose ourselves to a sickness that has killed many people in order to gain immunity. So again, the natural immunity that we get from the exposure that we have to a sickness like COVID in this particular case is a fairly short-lived immunity at this time. We will certainly be learning more. And we of course want more and more natural immunity, but it is something that has been really discerned carefully, that we cannot depend on natural immunity, and that the exposure to the illness can be dangerous to us. So we want to get our immunity from something that is safer than the sickness. And the vaccine is a safer way to gain immunity than the sickness. So I want to make sure that I've answered that clearly. With that, my dear colleagues, I need to depart. I know that you have other great panelists that are probably very excited to add to some of the answers that I provided and answer more questions. I want to thank you for your interest. Do continue your discernment without fear and with curiosity and the good curiosity that you have, and do enjoy your lives with wisdom and discernment as we go forward, and do pay it forward and take your vaccine as you are able. Have such a beautiful day now. Thank you for having me.
Thank you, Dr. Tokars. Thank you for taking time out of your schedule to speak to us today and answer our questions. And you too have a very good day.
Thank you.
Thank you.
Wishes now.
The rest of the panel is going to remain to answer just a few more questions. So Dr. Cohen, do you have a question that you would like to ask that was submitted that you would like to ask?
Sure. So one of the questions that I saw from the chat was why are physicians not required to report VAERS? That's actually an incorrect statement. Physicians are required to submit any sort of adverse events that occur. And let me start off by saying a VAER, it's a VAERS. That stands for Vaccine Adverse Event Reporting System. So that's our vaccine adverse event reporting system. If there are certain adverse events that occur, then you're required to report them. I'm going to share my screen and pull up the CDC's website here so I can show you some specifics. So here's the CDC's website, and it's showing the reporting of adverse events following vaccination. This was actually set up prior to COVID, but this is specific. This is showing specific adverse events that occur with COVID. So basically, if you're a healthcare provider and you have a patient and they have a vaccine that was administered with errors, you're supposed to report that. If you get any adverse events, including these 6 here, which would be death, anything that would be considered life-threatening, anything that caused inpatient hospitalization or prolongation of an existing hospitalization, any persistent or significant incapacity or substantial disruption of the ability of normal conduct, any birth defects, or any important medical event based on appropriate medical judgment that may jeopardize the, one second, so I can read this because this blocked me. Jeopardize the individual and may require medical or surgical intervention. So there is a system set up where we're supposed to report this. And there's even actually, furthermore, just past the COVID vaccine is there's a 5-page document with all the major vaccines that kids get. And it has lists of specific symptoms you're supposed to be looking out for. One more reporting system that we have is for individuals. Once you get vaccinated, there is something called vSafe. You could go to vsafe.cdc.gov and you can register and you can share your own symptoms. They will text you. I believe they start off texting you daily and then it goes out to weekly for as long as you are exhibiting any symptoms or have anything to share.
Great information. Are you done?
I'm done.
All right. Tristan, I think you had another question. Number 9.
I believe that was one that Samaria actually asked.
Oh, okay.
So
Oh,
far.
okay. Sorry. I'm okay. Yeah, I thought we had not asked that one. My bad. All right,
No
then
worries.
I'm sorry.
Oh, I said no worries.
I'm going to take the next question then. It is ABC 15 in Arizona ran a news segment titled Unheard Concerns, where they discussed 10,000 Americans having reported tinnitus to the CDC's VAERS database. Will this injury get better or is this permanent? Well, I went to that news story and I wanted to answer that question because it's a really good example. When you hear raw numbers, people get scared. And so when you are getting this information, you need to realize that that is a raw number and what you need to know is the frequency. That was 10,000 out of 200 million people that have been vaccinated. When I did the math, this is only 0.005% of the people that were vaccinated. This is compared to the 14% who had COVID that got tinnitus and the 7% that had COVID that got hearing loss. So there's two things that you need to think about. What's the frequency versus the raw number? And the other is what are the risks with COVID? So that's what you're trying to balance or compare the risks. What are the risks of the vaccine versus what are the risks of COVID? And in fact, these numbers were actually mentioned in the story itself. So had you gone, or if you go and read the original story, sometimes there's more information in that than what is being shared on the internet. As for whether this is a permanent condition or not, the only person interviewed in the story, I think, said that after about 6 months, it got quieter. Now, maybe it's going away, maybe it's not, I don't know. However, I did do a search in the primary literature, and there was one case of someone getting tinnitus after having the AstraZeneca vaccine. And it did go away after treatment with the steroids. So again, these are only 2 cases. This is not big numbers, but at least we know of one case where it does go away. And that kind of brings us to our final question. Professor Mager, if you would like to ask that one.
Okay, as the narrative, opinions, directives, and science seem to change constantly, please explain how information from this panel will be helpful to those in attendance. Well, there's been a lot of information presented today. Whether you need to deal with this, or excuse me, whenever you need to deal with an issue, whether it's this one or any other for that matter, we hope that you will always use your critical thinking skills. First, always question ideas and assumptions. All right, don't just accept them at face value because you heard them from someone. Next, go out and actually do your own research, gather more information, break it down for yourself, and most importantly, be objective as you're doing this. Finally, all right, as you're doing this, don't let emotion get in the way. That's what's happening a lot right now these days. And then go ahead and make your informed decision as you move forward in life. Now, in terms of what you should do is, like I say, to get more information, go consult your doctor. All right, look at peer-reviewed journals. All right, or go use reputable websites like PubMed or the Illinois Department of Public Health. By following these steps, hopefully you can deal with any problem that you're faced with in life.
Did anyone else have something they would like to add to that? I mean, Dr. Tokars did kind of address this a little bit, where she was saying just, not everything is good and not everything is bad. And that's, again, kind of removing your bias and being open-minded and doing your own research. All right, anything else you'd like to share or add? Let me check. All right. Well, if there's nothing else, this then concludes our panel discussion on the COVID-19 vaccine. I do want to mention that with the questions that we asked today, we were submitted questions from students and members of the community. And because the topic of today's panel discussion was the COVID vaccine, and also for the sake of time, we limited our questions to those directly related to the vaccine. In addition, when we received multiple questions on the same topic, we tried to create one umbrella question to cover all of the questions. Well, thank you to our co-hosts, Samaria and Tristan, and panelists, Dr. Cohen and Mr. Mager, and to the attendees. Thank you for joining us, and I hope we were able to answer at least some of your questions. Goodbye, everyone, and I hope you have a good day.